Hey guys, welcome back. Today I want to talk to you subject I get emailed and asked about a lot. I've skimmed over it some, but not dedicated a video just to this, and that is about natural alternatives for pain and chronic pain. Of course, there's other things that go with this. I'll talk about different, herbs or things I've talked about along the way that, hey, this helps with pain. You keep note of that. But this is kind of a dedicated thing to pain, chronic pain, especially those. This is my thing. I'm not, not judging anybody about anything. This is one of the, like I say, so many of my things is especially those who are on or been on some type of narcotics, some type of, pain, therapy of a prescription type medication for a long time. Number one, if you've been on them, they are extremely hard to come off of. They can be extremely dangerous to come off of cold turkey. There's the whole thing. I'm not going to get real in depth about that. Everybody needs to do what's best for them. My concern for people is if they're used to having that and their body's used to that, and then all of a sudden it's stripped away, they can't get it, they're not going to be able to adjust or have the things on hand, to switch over to, especially if you're wanting to come off of things. And please, again, anytime you are on prescription medications, please do things safely. That is most important. Talk to your doctor, keep in the loop, whatever. Okay, I want everybody to be safe. But if you can't get them when SHTF hits, a lot of times, and I will say this: if you are have come off, trying to come off, or want to end up coming off, it can be extremely hard, and you need to go ahead and know that now. That I've had tons of patients, even when I was in orthopedics and everything, it can be extremely hard to come off of them, because most of them, I've talked about before how they kind of quiet an area of your brain, and that communication of the pain to your brain, what that does. So when everything starts waking up, sometimes people get this really bad rebound effect. They get withdrawal symptoms and so on. Please educate yourself on that. Speak to your doctor. Be safe. So let's go through some more. There's a controversial one on here, but I'm gonna explain that because it needs to kind of lose its bad rap. But of course, big one you hear for pain, it's a natural thing, is turmeric. I talk about turmeric all the time. That is great for different pain. For chronic pain and everything, I usually recommend people do a tea, because also with the heat, like a steep, because the heat of the temperature hot of the tea is how it's gonna absorb is gonna help. You can also do topicals if you have an area, it's a joint, it's arthritis. Do a topical salve or cream or something of that to that area, and then you can do capsules. Also, before I go through this, when I give this list, I'm not giving this list and saying you need to do every one of these. You may not need only but one, you may need two. Don't do every single one of these just right out the gate. Okay, sometimes I give lists and people think they have to get everything I just named. No, I'm giving several different alternatives. You can pick and choose or what works for you. Please always keep that in mind. Another one is stinging nettle root. You can, again, I've talked about that for a lot of different things. You can do it as a tea, you can get it in capsules, you can dry it, buy it in bulk dried or anything like that. It's really good for that. Vitamin D3. Whenever I talk about vitamin D, I'm always saying vitamin D3. Vitamin D2 is synthetic. Don't mess with it. Don't touch it. Vitamin D3. And I would, because it's really good. It's really good for pain and inflammation and things. And I would do 20,000 to 30,000 IUD of that. I did a video on, I think it was 4 natural alternatives for prescription meds, and one of them was how you can use vitamin D in place of, or like if you're on steroids, and I'll attach that just in case you're interested. Omega-3s, fish oils, that's really good. It's good for your brain. And this one I do always recommend people to have, especially if they're coming off anything, because it's going to help with the pain. It's got vitamin A, vitamin D in it, but also the DHA in it, which is good for the brain, and that your brain is affected and areas are shut off when you're taking, narcotics, prescription med, things like that, because of what it does, and you're going to want that help. The next one is something called DMSO, which is dimethyl sulfoxide. DMSO is usually always how you'll see it. You can get that in a cream. Okay, so like I've had, known people and, patients and different things, and they would like, if they had spine, back, different things like that, joints, you can do that as a cream on the affected area, and it absorbs very well through the skin and it penetrates the cells without damaging them. And it's really good for pain and inflammation. I will list these in the description. Another one is B1, which is benfotiamine. That is good for neuropathy type pain. This is a good one, which is B1. It's good for like diabetics who get that neuropathy, pins and needles, type pain and stuff. This is a good one for that. Here's my, it can be controversial, but I think it's controversial because people aren't, and I don't mean this ugly, they're not real educated. They just clump things together or they hear things, and that is CBD. It can be an oil. It can be, you can get that in, drops. You can get that in topical things, lots of different ways. But that is from hemp. It is legal in all 50 states. It's not going to give you the side effects like a THC. You're not going to get high from that. But it's good for pain. It's used for a lot of different things. And it is good for pain. I won't go into everything it's good for. It has a lot of really good medicinal uses with very, very good success. But we're going to concentrate on pain, chronic pain with that. Now, with a lot of these, I say this all the time about holistic naturopathic things, is it is not like allopathic medicine where you take something, it's like, oh, I felt that, oh, I felt this difference in 15 minutes, or in 24 to 48 hours, it was just gone. Because this is going to, a lot of this is going to fix the problem, not Band-Aid the problem. Okay, so keep that in mind. You got to be patient with your body. You got to be patient with the things, and of course some work better for one, may work better for this person and not for you, and vice versa. So the CBD, like I said, you can also get that salves, lotions for, particular, like a lot of people do that for if they do topical, if they have like arthritis. Oh, you can just put this right on the joint. But when you get CBD, again, I'm not affiliated with anyone. I do not push, I will tell you if it's something I use and something I trust. I will tell you. I'm not affiliated with anyone. What I'm going to say about CBD is you have to make sure it is certified organic and has a certified organic seal on it, because you will come across synthetic CBD with a lot of additives, and number one is it's junk. It's not going to work, but also it can have negative side effects. Okay. And when you start that, I would start really low, like 5 milligrams, then go to 10 milligrams. But the max I would take was either 20 milligrams to 50 milligrams max. But if you haven't used it or started, and everyone's dosage is going to be different. You have to start very low for a little bit and then build up and see which way works better for you. Okay. A lot of people, you'll go and you'll get the full spectrum because it will have no additives. That's something you need to check for. Certified organic with the seal on it. If it doesn't say that, or you're like, I can't find it, it's not it, because it'll have the seal on it. It has to. And then look for something that has, no additives. It's, it's a pure or whatever. Sometimes it'll be like in a carrier oil or something like that. That's fine. Moringa, I did a video on this, but a lot of people have success using that, and you can get it in powder forms. You can get a lot of different forms. It's for pain and inflammation. Okay. There's another one, willow bark. A lot of people know willow bark. It is where aspirin came from. It's the natural, natural aspirin. It's the, nature's aspirin. People can have, success for that. That one can have warnings if you have certain medical things. I will write that down. So, again, be safe. And again, don't start every single one of these I gave you on a list for that. And you also, you're going to have to leave it to you, because there's so many different prescription meds for this area. If you were on something already, some of these you may not want to mix. You're going to need to call your doctor, your pharmacist, and again, be safe. Ice and heat therapy, you can do those in a rotation, and then I'll explain which is better for what. You'll do it like 10 to 15 minutes on and then off. Okay. And you can do a rotation. Heat is usually, I'm going to relax this muscle if it's spasming up and cause it, because a lot of times our muscles can spasm up and they're going to pull your ribs, a joint, something out of whack because it's tightening down, and then it'll cause, you know, it kind of spider webs and does this connection of different pain. I usually think nerve pain, like it's got to calm that nerve down. And so you need to, you know the difference. Is this like, you know, is this muscle, or is this, you know, it's like a soft tissue, or is this a nerve pain, or what? If you have an acute injury, you usually do the first 24 hours, you're going to do ice, you know, and do the 10 to 15 minutes on and then take it off, do a rotation like that. So not like I would usually tell my patients, do ice 10 to 15 minutes every hour for the first, you know, 24 hours. After that first 24 hours, if you have, sometimes if you have like a fluid or an inflammation or something, you can put heat on it and it'll help your body reabsorb that. Okay. So these are things I want to bring to, you know, your attention. I hope it helps, because know these things now, because, you know, unfortunately this is a big area that a lot of people like, I just can't get off of this XYZ med for this chronic pain, this condition. It could be a lot of different reasons. And you need to do that safely, but you need to get on to at least knowing and having things on hand alternatively in case you cannot get it. Crap hits the fan, it's, you know, that's it. You're going to be in bad shape going cold turkey and not having anything on hand that's natural to take care of those things. So everyone, stay well, God bless, and I will see you next time.